Helping you live healthy. This week is National Women's Health Week, and doctors are reminding women and girls to make their mental and physical health a priority. This includes keeping up with routine screenings and checkups. Joining me now is Dr. Taryn Smith, a women's health specialist from Mayo Clinic. Thank you for being with us this morning.
Good morning. Thank you for having me.
Why is it important for women to have these routine checkups?
Well, women have very unique healthcare needs, and so these checkups are important for a number of different reasons. First of all, it's a time for a woman's physician or a healthcare provider to assess a woman's current state of health. It's a time to discuss strategies to prevent chronic diseases. It's also important to screen for certain diseases, whether that's screening for high blood pressure, diabetes, cholesterol, or even mood disorders. And then if women have chronic medical conditions, it's also a time for her physician to monitor those diseases for progression.
What role does family history play in the need for women to get screened for certain illnesses or diseases?
That is an excellent question. Family history is very important, and it's very important for women to know their history, their family history, and relay that to their healthcare providers, because it can change how the healthcare provider will screen a woman for certain chronic conditions, whether that's cancers or heart disease. It can definitely change things.
And some of the screenings do vary depending on the age. So let's start with those who are younger, in their 20s. What are some of the things that they should keep in mind from an annual wellness perspective?
In the 20s, a lot of times these exams may largely focus on reproductive health. That may be prevention of pregnancy with contraception, or it could be preparing for pregnancy. It's a good time to also talk about safe sex practices. But one of the big things that happens in the 20s is that we initiate cervical cancer screenings with what's commonly known as the pap smear. And so that should start at age 21. And if pap smears are normal, then women should get pap smears every 3 years throughout their 20s.
And when we move into the 30s and 40s, what about those years for women?
During the 30s, those exams are, for the most part, very similar to what they are in the 20s. However, one thing that does change is the interval of pap smear or cervical cancer screenings. If exams are normal, those screening exams can be done every 3 to 5 years, starting at age 30. And we continue pap smears all the way up to age 65, as long as women have a history of normal pap smears or cervical cancer screening exams in the past.
And one of the other common screenings that women do need to get is the mammogram. Maybe that's what you were getting to next, but when is it the right time for women to make sure they are getting that mammogram regularly?
Well, the American Cancer Society recommends that all women should have the opportunity to initiate breast cancer screenings with a mammogram starting at age 40. And for the majority of women, those breast cancer or mammography screening exams will occur every year, in some cases every other year. And those exams should be continued throughout a woman's life as long as her life expectancy exceeds 10 years.
What about women in their 50s and 60s?
Yeah, so I do want to just take a quick second and scale back to the 40s for a second, because this is a really challenging time period for a lot of women. It can be a time of great transition. Women can have more obligations at work or obligations at home. They can be more established in their careers. But from a healthcare perspective, it's really important to start getting on top of cardiovascular risk factors early on, before you've even had the opportunity to really develop these plaques in the heart. It's important to make sure that we're checking cholesterol, that you've got a good diet. Mediterranean diet is one that's really good for heart disease, lowering blood pressure, and also for weight loss. And exercise too. Exercise is really good for the heart. A good recommendation for exercise is 150 minutes of moderate intensity exercise in a week. So that can be 30 minutes, 5 times a week, or however you want to slice it. But it's really important to get on top of those things early. Another thing that can happen in this time frame in a woman's life in her 40s is she can start to experience hormonal fluctuations. And those hormonal fluctuations can lead to irregularities with menstrual cycles as a woman is starting to enter into the menopause transition, or what we call perimenopause. That can be a challenging time because women can often start to experience those typical menopausal symptoms like hot flashes, night sweats, and irritability, so many different things. And so it's important for women to regularly check in with their doctors, particularly their women's health specialists, to address all of these needs.
Doctor, this is a lot of great information. Real quickly before we let you go, there is an event that is happening next week.
Yes, so the Mayo Clinic is going to be hosting a panel in conjunction with the Duval County Public Schools Health and Wellness Series. And essentially, it's going to be a panel of women's health experts from the fields of gynecology and menopausal specialists and cardiologists, really to provide some more clarity about changes that occur throughout a woman's lifetime.
Dr. Taryn Smith, thank you so much for being with us this morning and providing all of this great information.
Thank you for having me.